Are men really wired for higher sex drives? Then what to do when your favorite positions start to hurt? Plus, we talk about the most popular herbs. Next on Sex Talk.
Welcome to Sex Talk, where we answer the questions you've always wanted to ask about sex and relationships. I'm Dr. Leah Janine, Associate Professor in the Department of Health and Human Performance at Nova Southeastern University. And joining me is Sex Talk correspondent Derek Latta.
Dr. Leah, a pleasure to be here as always. Great to see you.
Same.
We have some amazing questions today. Are you ready?
I'm looking forward to it.
Okay, here we go. I get a lot of ads for chocolates that get you in the mood. How do these work?
Chocolate can stimulate serotonin, which is believed to be a sexual stimulant. Serotonin sends chemical messages between nerve cells in the central and peripheral nervous systems, telling the body how to function. So many would agree that eating chocolate makes you feel good, but it's probably the placebo effect combined with the sensual pleasure of it melting in your mouth more than anything.
So a placebo effect. So how about these special chocolates that do they work?
The special chocolates.
Just special.
Well, oftentimes they have got maca or some other substance in them. So it's not just the chocolate in and of itself that's supposed to be increasing sex drives. The biggest thing is there are no peer-reviewed research that indicate that any food is an aphrodisiac.
Okay. Our next question, Dr. Leah. A woman says certain positions hurt all of a sudden. Why is this happening and what can I do?
There are several reasons that this can be happening. You'll want to figure out the issue to move forward with what to do. Is it during penetration? A common cause could be not enough lubrication. This might be due to not enough foreplay or certain medications, but it could also be caused by hormone changes after breastfeeding, giving birth, or menopause. Make sure it isn't an injury or an infection. Anything from a skin problem in that area to a UTI can cause pain. Vaginismus can also be the cause. That's when there are involuntary spasms of the muscles in the vaginal wall.
That doesn't sound like fun.
Yeah, and there can be a lot of different causes there. I mean, a lot of times it can be, previous sexual trauma. There's a lot of different reasons that can happen, some that aren't just physical.
Okay, any other type of pains?
Well, if it occurs with deeper penetration, especially felt in certain positions, it may be endometriosis, fibroids, or IBS. Sometimes surgeries can lead to scarring that then causes sex to be really painful. Emotional factors may also be the cause. Stress can cause your pelvic floor to tighten. Anxiety and other psychological issues can lower the level of arousal, leading to pain. If you're experiencing pain, it can be difficult to relax and it may lead to avoiding sex.
Dr. Leah, just curious, why does it hurt sometimes and not others? Other than, let's say, medication, is there anything you can do about the pain?
Well, NSAIDs can be one thing, but if it's recurrent pain, you don't want to just kind of take a pill to make you feel better. Always talking to your doctor, seeing really what the root cause is, because there's so many different causes of vaginal pain. You kind of want to get to the root of the issue.
Okay, well, good advice. Dr. Leah, we'll take our next question. My boyfriend doesn't get an erection during foreplay, and that's never happened with other men. Is it me or is it him? Is there anything I can do?
Several factors can affect erections, and it isn't always easy for everyone, even younger people. To get an erection involves hormones, the nervous system, and the cardiovascular system. It all begins with stimulation or something that is felt or seen that triggers the nervous system and increases the blood flow down there, continuing until climax. But if someone has erectile issues, any of this can change.
So, Dr. Leah, does that mean they have ED?
Well, ED is on the spectrum. The National Institutes of Health estimate that it affects 30 million men in the U.S. Some men struggle to get an erection every time. Some can't last long enough, and some might only have symptoms occasionally.
So what would be the other causes of this?
Well, when struggling with erections, evaluate your overall health. Make sure nothing else is contributing to the issue. And if you're taking drugs, drinking, or on other medications, consider the impact. Don't drink right before having sex if you started a new medication. Talk to your doctor about the potential side effects and don't underestimate stress or other mental health conditions because they can be the cause.
You know, we get a ton of questions about ED and erection situations and all that. So a lot of people are very concerned about this. So exercising, eating well, that's the key. I mean, you're an expert in this thing.
Yep. So actually, it was my first research study I ever conducted, was looking at the relationship between exercise or physical fitness and sexual, performance. So sexual functioning, orgasm, arousal, behavior, drive, all of those things. And it was interesting because all of my hypotheses were wrong. I really didn't expect it to affect women the way it did. Unfortunately, the majority of research is on men when it comes to both exercise, particularly strength training, and sexual functioning. People just seem to only care about men. But what I actually found was most interesting is that cardiovascular health, which was determined by VO2, so how efficiently your body is moving oxygen, determined arousal in women, but actually not men, right? So I'm assuming that it is also related to men in some form, but I found that it helped women be more aroused. I also expected your stereotypical big jacked beef guy to be the one that had the most amount of partners and the highest sex drive, and I didn't find that either, but I did find that strength was directly related to their sexual experience and sex drive, and even number of sexual partners. So what I think was most interesting is I grew up, as a lot of people did, with the stereotype that like a promiscuous woman must have daddy issues or self-esteem issues, and I found the complete opposite. The women that defined themselves as strong were actually the women that lifted the most amount of weight. So they were the ones that were strongest, as determined by an isometric hand grip strength test. And they had, hand grip. It's related to almost everything, like longevity, everything, but they had more partners and defined themselves as more powerful than people who didn't.
Our next question?
Yes.
Dr. Lee, you ready? There we go. Is it true that women typically have a lower sex drive than men?
Depends on the woman, right? This seems to be the case. Many women allow men to pursue them, to be dominant. So there is this idea that men are the ones who are initiating and after sex. While there is some research that indicates that men have higher sex drive, the difference really isn't that high. The research is not that black and white. Plus, there are so many factors to consider besides gender.
Tell us a little bit more about the research.
Well, some researchers had to work through defining sex drive, right? You can ask someone how much they have sex, but some people want to have sex more and don't act on it, or maybe the opposite. They are having sex, but really don't care to quite have as much sex. Research does find higher sex drives in men, but both men and women had variable responses. So not all men were scoring high and not all women were scoring low. The numbers were much more scattered than imagined. For example, almost a third of women had higher sex drives than the average man surveyed. So maybe gender differences don't matter as much as we once thought.
And Dr. Lee, we get a lot of questions about sex drive. So what are the other factors besides gender?
Well, a lifestyle, for one. A busy life can make people too tired or too preoccupied to think about sex. General health habits like nutrition, exercise, and sleep can also affect sex drive. Mental health is really important. Stress, anxiety, depression, and low self-esteem can all affect sex drive. Relationship issues clearly can be another major factor, as emotional closeness is often the key to sexual intimacy. Medical conditions such as chronic health conditions like chronic pain, autoimmune disorders, or diabetes, again, can be a negative impact. High blood pressure, any vascular conditions can also affect arousal by affecting the blood flow to the genitals. And of course, medications. Any hormonal contraceptives, chemotherapy, and certain antidepressants can affect sex drive. Hormones, hormone levels, testosterone levels, anything like that can affect sex drive. So there's a bunch of different things to really take into account.
You know, of all those factors, I mean, some are unavoidable, that maybe they're hereditary or something. The first thing you talked about was lifestyle. It causes stress if they're not exercising right or eating correctly. I mean, that's within your control. So that's probably the first place you should try to change and make your life better, and your sex drive hopefully be a lot better.
Yeah, I mean, and it goes hand in hand with overall health, right? Stress causes a whole range of health issues, cardiovascular issues, even dental issues, which has really surprised me. So it links to sexual functioning. I mean, think about it. When you're really stressed out, no one's really in the mood. Same thing with not getting enough sleep. We are a nation of undersleeped individuals. And if you're really tired, sex just isn't going to be the top of your priority list.
Yeah, it's lifestyle. There you go. Yeah. Next question. I was looking into herbs like maca root and horny goatweed. I love that name. As a natural way to increase sexual performance. What's the best way to consume them? Remind us again, what does maca root do and for your body? What is that?
All right.
We talk about it a lot.
Oh, yeah, we do talk about maca, but the maca plant is a Peruvian root. It's been growing in the high Andean plateaus for over 2,000 years. The Andean people have long used maca in their diets. These days, maca is getting a lot of buzz for supposedly boosting libido and fertility, and it's grown all over the world. It's packed with fiber, vitamins, minerals, and other beneficial compounds. Maca sounds like a superfood dream. However, the science is still catching up. More research is needed to really prove its health benefits.
You know, this show is called Sex Talk. How does maca help with sex?
There was a study in 2015 where women who took 3,000 milligrams of maca root for 12 weeks had better sexual function and libido. However, I did a study and did not find a significant difference between the placebo. There was a significant change between pre and post with maca. However, women were so greatly affected by the placebo that we didn't see enough of a difference in the various change scores. Not to say that it doesn't help women as well.
Okay. And Dr. Lee, what are the differences in the maca powders?
There are three main types: raw maca, activated maca, and concentrated maca. Raw maca, it contains high levels of starch, bacteria, yeast, and mold. Because of this, it must be boiled or cooked to activate the beneficial components and to eliminate potentially harmful substances. Raw maca has a strong, earthy flavor and is best used in teas, porridges, soups, stews, and baked goods. Typically, it's not recommended due to its unpleasant taste and potential health risk. Activated or gelatized maca can be eaten raw or cooked, making it popular for modern healthy lifestyles. It has a higher concentration of bioactive compounds, lower starch content, and is sanitized to protect the gut health. It is sweet, multi-flavor, makes it ideal for smoothies, lattes, and raw food recipes. Despite its name, it contains no gelatin and is completely vegan-friendly. Extracted maca is 10 times more potent than raw maca and is intended for therapeutic use in treating chronic conditions. It quickly absorbs in water and must be stored in airtight containers. Its sweet caramel flavor makes it perfect for mixing into water, tea, juices, or smoothies.
Is it good for baking, like brownies or cookies? Or
I have never baked with maca, but I mean, they sell maca chocolate brownies for like increasing sex drive. And it's not an immediate thing. That should be noted. It's not like you take a pill with maca and it's like sildenafil or anything like that. It's typically, over at least 28 days.
And how about horny goatweed? Does it live up to its name?
Great name for a sexual enhancer, right? That's another one that works by helping to increase blood flow, which helps with sexual functioning. It also has chemicals similar to estrogen, so people can use this for ED and issues after menopause. But like maca, we need more research to really back these claims.
And how do you consume it? Same as maca, for example?
Well, it comes in powder, gummy, pill, or liquid form. The liquid and powder vitamins absorb faster.
Okay, next question. I like that. I want to know what this husband's doing, by the way. Listen to the question. My husband likes to go multiple rounds, but I don't have the energy. What can I do to keep up with him?
Well, there are several ways to increase your sex stamina. Start with regular exercise. Studies show that there's a link between good cardiovascular health and improved sexual health. Some good cardiovascular activities would be swimming, biking, or dancing. Similarly, you want to watch your diet and make sure to include foods that are good for the circulatory system. This would be fruits and veggies, low-fat dairy products, whole grains, and nuts. As always, avoid too much sugar, salt, and saturated fats.
So what else helps with stamina?
Well, avoid stress because that can really kill libido. It also increases blood pressure and heart rate, which can affect your sexual performance. Quit smoking and reduce your drinking. When you smoke, it causes high blood pressure, which can lead to other health issues. With drinking, it can interfere with hormone production and overall isn't the best when you're looking to have more energy in the bedroom. Swapping alcohol for coffee may be the move, and there's quite a bit of research to prove it. One study surveyed men and found that those who drank 2 to 3 cups of coffee were less likely to get ED. I personally conducted an energy drink study that examined the effects of 300 milligrams of caffeine on sex drive, and I found that not only did it improve a lot of elements of sexual functioning, it actually improved your partner's response. So it was a landmark study in that arena because typically people only look at sexual functioning of the individual consuming the supplement. And so I actually found that after the male took the caffeine, women reported far better sex. Didn't work in the opposite way. If the women took the caffeine, men didn't necessarily report better sex. But so gentlemen, if you want to please your ladies, drink up.
Don't drink up?
No, drink up the caffeine. But
can I get a grande, please? Right here.
But it is to a certain extent. You don't want to exceed like 300, 400 milligrams because it'll peak the sex drive and then go back down. So, yeah.
Yeah, I was going to ask you, so how do you know? How many milligrams of caffeine in a typical cup of coffee?
Depends on how strong your coffee is, anywhere from 100 to 150. And energy drinks could be anywhere from 150 is on the low end up to 350. So 300 is a lot. And again, your caffeine tolerance plays a huge role, right? So like I'm somebody, if I consume an entire energy drink of 300 milligrams, I'm like shaky and it wouldn't work. But the whole reason caffeine works is that it actually promotes smooth muscle fluctuation. So like it affects your smooth muscles. Smooth muscles, the muscles you don't have control over, right? So that's going to be like your heart, things of that nature. So obviously, as we know, caffeine affects your heart. It beats faster. Mm-hmm. You're not controlling that. Mm-hmm. And so it's the same thing with stimulation.
Why is it they sometimes will say stay away from caffeine? I know it stimulates the heart, but they say stay.
It's a constrictor. Well, a couple of things. It's also a constrictor. Right, so we obviously think about with men, you want more blood flow to the area. So if it is constricting too much, that can present a problem. So it really just depends. So overall, I was actually surprised when I found out all the benefits that caffeine had on sex drive because of the constricting element. Mm-hmm. But the majority of the research is showing that it can affect. Obviously, if you got any heart conditions, arrhythmias, anything along those lines, you don't want to just be loading up with tons of caffeine. As I always say, talk to the doctor.
How about tea? How many milligrams in a cup of tea?
Depends on the tea, because some tea is completely uncaffeinated. So,
okay, sure.
Yeah.
Well, so just like coffee, some coffees are okay.
Yeah, so it completely depends, but it should be listed there. At least energy drinks, it's listed.
Okay. Is there anything else that you can tell us?
Well, there's a lot to try. Masturbating could help increase sexual desire, but too much porn can mess with your sexual performance and desire. Also, make sure you're getting enough sleep. Studies link sleep to sexual performance. So there's a reason to go to bed a little earlier or sleep in a little later.
How do you know if you're masturbating too much? You said...
Well, a big sign is if you are preferring that over your partner or you can't get aroused by your partner. That's usually one of the biggest things that you see in like porn dependence. So if it's somebody that just can't be with a person anymore, that's going to be an issue. And as with all addictions, if it's interfering with your daily life, if you're seeing any negative consequences, those are just going to be overall any type of addiction. But it does happen that people become porn addicted and then get ED as a result. Right? So I'm not against it. There are many cases that people have mismatched sex drives. Mm-hmm. And so you don't want to be constantly coercing your partner. Mm-hmm. So I don't think there's anything wrong with it, but you want to be picking your partner first, and then that should maybe be a secondary.
And it's reversible? Let's say you just stop. Can you get your normal feeling back? Or?
Yeah, so it's not like you're screwed for life and you're going to have a lifetime of ED just because of porn addiction. Yeah, things will happen more naturally there. And you know, it's very tricky. Some people then abstain from porn completely, like if you were an alcoholic, but it really just depends on your individual treatment plan. But yes, it is a psychological issue at that point. So with therapy and other things, you can get everything back in working order.
I mean, I guess porn has its positive use as well. Maybe therapy or... Yeah,
I mean, it can have a positive use, but again, it depends on the couple. There's a lot of couples who see that as cheating, and if one partner does see it as cheating and the other one doesn't, clearly that could present a problem. So it really just depends.
Okay, thank you. Our next question, Dr. Leah. Whenever I have sex, my joints lock up. What can I do besides switch positions?
Joint stiffness is a very common concern and something most of us will experience. The older you get, the more likely this is going to be a concern because your joints have a lifetime of use. As we age, our range of motion becomes restricted and we become less flexible. Even the cartilage between our bone wears and can cause inflammation and pain. Too much body weight can lead to inflammation and also put extra pressure on those joints. Other factors include the way you sleep, the time of day, diet, and any other health concerns.
Yeah, you mentioned concerns at the beginning as well. What are some of the health concerns?
Well, bursitis is caused when parts of the joints become inflamed, causing pain and stiffness. This occurs anywhere, but more common in larger joints like shoulders and hips. Osteoarthritis, which affects over 30 million people in the U.S. Osteoarthritis happens with wear and tear and affects fingers, hips, knees, and more. Treatments focus on reducing pain and swelling, and sometimes surgery is even needed. Other conditions that cause stiffness include gout, lupus, rheumatoid arthritis, and fibromyalgia.
Dr. Lee, you mentioned some treatments. What would you recommend? What works for joint stiffness?
There are over-the-counter medications aimed at lowering swelling, pain, and joint stiffness, like an NSAID, such as ibuprofen or Tylenol. In fact, one study showed that NSAIDs can be as effective as opioids for severe stiffness.
When should somebody see a doctor? When they can't move, they're so stiff?
Well, yeah, there you go. If the stiffness is all of a sudden or it isn't going away after a few days, then you definitely want to talk to your doctor. Other symptoms to look out for are rapid swelling, severe pain, deformities in the joints, joint redness, or anything that seems hot or there's a loss of mobility.
Are there any home remedies that you've heard of?
Well, there are some things to try at home, like heat therapy, exercising, of course maintaining a good body weight, having a balanced diet, and trying certain supplements like fish oil. Trying something like yoga could also help relieve some stiffness for the body, but connect with your doctor if this is something that affects you chronically.
Sounds good. We'll take our next question. You
Okay.
ready? Here we go. Are people in monogamous relationships happier?
According to some research, people in non-monogamous relationships can be just as happy as people in monogamous relationships. A 2017 article by Psychology Today found that people in consensually non-monogamous marriages reported similar levels of satisfaction, commitment, and passionate love as those in monogamous marriages. Another study in sexual and relationship therapy discovered that older adults in open relationships reported being happier, healthier, and more sexually active than the general population. And another study found that people over 55 in open relationships were generally happier and healthier than their monogamous peers.
And what makes people as happy in these relationships? What's up?
Well, many say that non-monogamous relationships can provide the same sense of security, value, and love as monogamous ones. For some, the freedom to seek new experiences without losing the bond with their primary partner is a major plus. However, it's worth noting that open relationships can be a lot of work and might not always succeed. In the end, happiness in a relationship, whether monogamous or not, really comes down to the individuals involved and their ability to communicate and understand each other. Every relationship is unique, and what works for one couple might not work for another.
How common are these open relationships?
Well, they are more common than you think. One survey found that 5% of respondents were in an open marriage, and 20% had actually participated in one at one time.
And what type of relationship did they look at to get this information?
Well, they were looking at polyamory, swinging, and an open marriage. In polyamory, partners are able to get with other people while the marriage is the primary relationship. This might be because they recognize their one partner can't meet all of their needs, so they have another outlet. Swinging is when married couples swap partners, and this is mainly sexual in nature. And an open marriage is when one spouse has sexual relationships with other people, but hold back on deeper emotional connections. And every couple has their own boundaries for these types of situations.
Yeah, sometimes couples will do this just when they have kids. They'll have an open relationship because they don't want to end it because they want to affect the kids. I know some people have done that. So.
So do I, actually. And I know somebody else that one had cancer forever, and he was really just dependent on her and was thankful that she worked through it. I don't think either of them really wanted to be together, but the thought of actually getting divorced was just too much. And they're a much older couple. They've been married for, 35 years. And so they're still married, but kind of doing their own thing because they really loved and cared about each other as best friends and didn't want to separate.
Okay. So. As long as it works for them. Like you said, it's different for every couple.
Yeah, to each their own.
Okay. Our next question. Dr. Leah, does vaginal rejuvenation make sex feel better, or is it just for aesthetics?
A common vaginal rejuvenation procedure is vaginoplasty, where the vagina is tightened. This procedure can improve tightness, appearance, and even pleasure.
I was going to say, how does it increase pleasure?
Well, there are a few ways. For starters, a new youthful appearance can be a confidence boost that makes its way into the bedroom. And then with the tightening, likely comes more sensitivity. Most women do report increases of arousal after surgery.
Are there any other type of vaginal rejuvenation procedures, and do they work?
Well, another common one is labiaplasty, which is a surgery that reshapes the labia. As you might imagine, this also affects the appearance, but can lead to increased pleasure as well. There are even some non-surgical options that work to improve the appearance and pleasure. These could be a good option if you're looking for less downtime or you don't want to do surgery. Overall, doctors report that as many as 90% of women experience the benefits of vaginal rejuvenation procedures.
That's a fascinating topic, actually. I never would have thought about that. Okay, our last question of the day. Can I cure my asexuality?
Asexuality is a sexual orientation, and it isn't something that can be cured or fixed with therapy, medication, or a partner. It is an inherent part of who someone is, and it doesn't require treatment. However, therapy can be helpful for individuals to accept and understand themselves better.
What is asexuality? What does that mean exactly?
Well, when we're talking about someone that's asexual, asexuality is really different for everyone. Sometimes people never experience sexual attraction, while others might only feel it after developing a strong romantic connection. For instance, demisexual individuals only experience sexual attraction when they have a deep emotional bond. Additionally, asexual people may feel romantic attraction without wanting to engage in sexual activities. If someone's lack of interest in sex appears suddenly or is driven by emotional factors, they should talk to a doctor or a therapist. They could have a loss of libido, sexual dysfunction, or fear of intimacy.
Okay, fascinating again.
All right, well, Derek, this is another great show. I loved answering these viewers' questions. We're all out of time, but we'll see you next time when we answer the questions you've always wanted to ask on Sex Talk.